Hello. Hello,
Hi.
everybody, and welcome to another exciting edition of Living at Your Highest Quality of Life with the doctors at Inspire Wellness. I'm Dr. Dan Neides.
Hi, Jessica Hutchins.
Great to be with you. We have different bumper music today. I love it. The suggestion of the Love Shack.
Yeah, I heard it on my way to work today. I thought, oh, that'll be perfect for what we're talking about today.
Adorable. 216-965-9303 is our phone number. Functional medicine, medical cannabis, IVs, ozone, you name it. Let us help you. Peptides. We're going to talk peptides today, but 216-965-9303. Let us know how we can be of help to you on your quest to be the best version of yourself. Awesome.
All right. So how, in reality, how often do you see low libido? I mean, do people talk about it a lot? Or?
Yeah. Well, men, women, common. Absolutely
Sure.
common. But this has been going back, I think, once the Viagras and the Cialises came on the market 25 plus years ago, it opened the door to the conversation. I think it was not common for people to talk about it openly. And now I think people are willing to really talk about anything regarding their health, including their sexual history and the challenges, especially when it comes to this specific topic of libido and people asking, like, how do I increase my libido? What do I need to do? And, you know, there's a lot to unravel in that, but a very, very, very common complaint.
Right. Yeah, I mean, a lot of people, I would guess maybe 80% or more of people that come to me, especially women, complain about that. But honestly, when they come in with a list of, 50 complaints, which is super common, usually in the back of my mind, I think, okay, well, let's fix everything else. And I'm sure your libido will come around after we fixed everything else, right? Oh, let's fix your gut and then your libido will be fine. Let's fix your cortisol and your libido will be fine, which is true in a lot of cases. But it's honestly something I don't typically try to address at the first visit because we just assume it's going to get better. And maybe it's not the most important to us, but it certainly could be the most important to the patient. Right?
I like your hair, by the way, the curly.
Yeah, so Mom, I don't know if you're still on Facebook watching this, but I feel like my hair looks like how you had your hair in like the 70s. So I'll have to send you a picture maybe.
Farrah Fawcett coming back. Love it. Anyway.
Which I think peptides actually helped with my hair growth a little bit, which is going to be a different Facebook Live. So this is talking for people who have tried to clean up their lifestyle, I guess, in a bunch of different ways. This isn't the talk for people who are still eating McDonald's every day, not sleeping well, drinking alcohol all day long, that kind of thing.
Well, I think the other thing that's really important from a libido perspective is really diving into the history to understand the relationship with their partner. Because it's important to ask, do they have a high sex drive outside of that particular relationship? Right? So, but you laugh, but it's important. I mean, you really have to understand, is there a psychological component to it in terms of maybe they're having stressors about the relationship or they're feeling a little insecure, whatever the reasons are. But once, you get past that and, person is well established in the relationship, just wanting more, then I think this is a great opportunity for us to intercede.
Right. Anything that we suggest is not a replacement for having a partner that you feel safe with under sexual circumstances. So that has to be first and foremost. And I know all the women know what I mean by that. That's the only way that you can relax, I feel like, is if you feel completely safe with your partner. So let's talk about some other things besides the peptides that can help with libido. Certainly hormones. So if hormones are off, then that could be the issue. If you have no testosterone, that could be absolutely the issue.
I'm looking at that, just wondering if this, because I never saw the countdown and the...
Right, there's a spinning thing happening now. So I don't know if you guys can comment and just let us know that you're really seeing this. If you don't mind, somebody comment. Anyway, we'll just hope it's working and keep going. So again, hormones. So if you have low testosterone, if you don't have any estrogen or progesterone, that could affect things. If you have blood pressure issues, so you're not getting the right amount of vasculature to the organs down there, I guess, that could be helping.
Sorry.
We're still making sure this is working, I guess. should automatically connect to that, I think. That's not the right thing.
Sorry.
Hold on. All right, so we just reconnected to Wi-Fi, so we'll see if that helps. So anyway, fix the underlying problems for sure. And if you need more blood flow there, the things that we're doing probably aren't going to help that well. But we do have a magic pill for lack of blood flow for sure. So that's kind of a separate problem, even though they're all related. What we're talking about now, as far as these peptide therapies go, is more for almost psychological or neurological issues. So what it does is it acts on receptors in the brain, these peptides that we use. And the specific one that we're super excited about is PT141. So you inject it as needed for the most part. So about 30 to 45 minutes before sexual activity, and it can last for a few hours. So you do need to plan, just like if you were taking Cialis or Viagra or something like that. But it really is great for those people, again, who the blood flow isn't the main issue, but it's the desire. And often blood flow really increases once you have the desire in most cases, unless you have blocked arteries or something like that. So it absolutely can help blood flow in an indirect way. It's really good for people who might have past traumas and real psychological reasons why, despite them feeling safe with their current partner and they want to be with their current partner, they still somehow can't get aroused. And women, I feel like, have much more of a problem like that than men, honestly. So I really do want to target women in this, but it's a really cool thing to try if whatever else you've been doing isn't working and you really do have a good relationship with your partner. So again, it's called PT141.
P is in Paul, T is in Tom.
And it's just a tiny little, like, subcutaneous injection. Really doesn't hurt at all. And there's some side effects. Some of the common side effects last anywhere from like 5 to 15 minutes, and there can be nausea, headaches, flushing. So you do want to do it a little bit well before you're about to engage in sexual activity, just because if you do have those side effects, you want them to wear off. Contraindications really are primarily if you have uncontrolled high blood pressure or if you have an allergy to something like that. But really, there aren't too many contraindications. Usually the side effects come more when you take too much of it. So it's only supposed to be dosed 2, maybe 3 times a week, and you're only supposed to give 1 dose within a 24-hour period. So I guess most people just don't have sex every day, maybe. But, you can still have sex, obviously, but it'll be more interest with this injection. It can really help you bond with your partner, too. And one of the ways that I didn't know at all until I did a lot of research into it that it can help is a lot of bodybuilders use it to help with their focus and motivation during bodybuilding. So it can also help with the focus and motivation during intercourse or sexual activity for sure. And so we're just starting to do that now. People have been asking us to bring peptides on board to Aspire Wellness for probably 5 or 6 years now. And we're just starting to. We've been using some peptides like NAD, glutathione is a peptide. Semaglutide, tirzepatide. So now we're getting into the more specialized peptides, and this one, except for the 5 to 10 minutes of nausea or headache in some people, it really seems to be pretty painless, harmless, no side effects, and it's worth a try again if you think your issues are more, you just don't feel interested at all, despite you loving your partner and wanting to be sexually active with your partner. And so again, it's worth a try. You do have to time it with intercourse. There are some people who say that it gives you the benefit if you just dose it twice a week, but for most of the reading that we're doing, it seems like it really is more beneficial, just like you would take the little Viagra pill. Just take it before sexual intercourse. And again, the side effects are way more if you take way more than the recommended dosing or more often than a couple times a week. And so if anybody's interested, let us know for sure. And certainly we can do the other things too. Make sure you have enough vitamins, make sure you're not zinc deficient, make sure you're not completely testosterone deficient. There are other things that can cause low libido, and like you were saying, make sure that you really do have a good relationship with your partner, because subconsciously that makes all the difference in the world.
Excellent. So if you have specific questions about peptides in general or this particular peptide, PT141, call us. We're more than happy to give you information so that you're comfortable and certainly we can schedule you a time to come in and give you more details. And I think it is important that we do look at all aspects of lifestyle, right? I think that's oftentimes overlooked when patients are looking at improving sexual health overall. It's you really have to look at, you know, the things that drive chronic disease, you know, things that we've talked about at length here. But, you know, those categories of inflammation and nutrients and detoxification are still critical from a systems approach. So those have to be, you know, in order if you want the peptide to actually work for you. Agree?
Yes, absolutely. And then that's why we love doing these new kinds of treatments with established functional medicine patients, because they're already trying to live a pretty clean, healthy lifestyle. And this is just for those refractory cases who, despite doing all the things, you know, you still just can't seem to get aroused. And sex is a really meaningful part of life if you know, use it properly. It's a very magical energy exchange that I hope all of you get to participate in.
Awesome. Well, appreciate that. If there's anything that we can do, please reach out, 216-965-9303. Any last minute tidbits? One take-home message.
Libido is important. Don't undermine it like I might have been doing with my patients, thinking, oh, that's the last thing to talk about. That's not that worrisome. That's, you know, I'm more worried about gut health, etc. So libido can really, it can keep you out of fight or flight. If you're in a good sexual relationship, it can be an outlet for uncomfortable negative energy as well. You know, you can just transmute that energy through intercourse, and, you know, it's a really a great bonding experience with your partner. But not everybody really has any interest at all. And it's, you know, everybody's busy and everybody doesn't sleep well, and, you know, you're running for a million activities. So I get that. But there still should be a little bit of time and desire to be with your partner. So we're here to try to help you make that happen.
Awesome. Well, 216-965-9303. Anything we can do to help you on that journey. Remember, it is your time to thrive. Let us inspire you. Love you guys.
Bye, everybody.
Have a great start to the holidays. We'll see you soon.